I would not consider myself an expert in any way on antibiotic resistance issues. And as I talk to students, if you talk to my veterinary students that I interact with, they'd say I focus on the issue of use. And I find it quite interesting that the speakers prior to me, this comes back to a use issue. And I think assurance programs really fit well in that. Especially for agriculture, as we look at how we use antibiotics, it's a partnership with our producers, our farmers, our ranchers, and the veterinarians to deliver these things to the populations we're doing those. And as we make the decisions for what to use, how we do that is important. How we get it in the animal, appropriately administering compliance and issues like that are important to do that. So as I go through these, I'm going to try to highlight where those fit and how they fit in those things. I chose the beef and pork quality assurance programs because I think they have some similarities that fit quite well. These are voluntary programs supported primarily through industry funds, through checkoff dollars. There's other ancillary funds that come in from industry and things like that to help some of the educational efforts, but primarily these are industry-driven efforts. The industry is driving these, is developing these, and continues to develop these as they move forward. And it involves a team approach that involves producers, veterinarians, nutritionists, and industry professionals as we look at that to administer these and move forward to do those. It's primarily focused on the pre-harvest segment of the industry. Again, down to the farm and ranch level, as I heard Dr. Thompson yesterday talk about, these are examples of the ground level things we do on a daily basis through these partnerships to get things to the ground, to make them happen, and I think will be important as we move forward to continue to make these happen. Both these programs use a HACCP-based approach to help develop what are the risk areas, what are the priority areas, how do we proactively address these. And try to implement science-based management practices as best available information to do that, and we'll talk about how they continue to evolve to do that. Both programs were initially focused on safety concerns, primarily violative chemical residues, residues in meat products and things like that, and these industries recognize that this is not acceptable. This goes out to our consumers and what is acceptable to our consumers, and targeted those things. So again, I'll go back to something Dr. Thompson mentioned yesterday. As we've primarily focused through these programs on preventing residues, we are developing practices that are best practices to help develop the use of antimicrobials. And maybe not so much that we've recognized moving forward from a residue thing, but we've moved to a stewardship application as we move forward in how these are done. Both programs have evolved to add in quality and animal well-being as focuses as we do that. And to me, that speaks of large volumes that we've moved to look at this as the production system and all the things that fit in there. It's not just the end user. Where does the animal go before harvest and what is that? It's throughout the production system and what are the other management practices that play in this that are a piece of the puzzle as we move forward to doing these things. And at the end, both programs have goals to ensure quality, safety, and confidence in their end products to the consumer. And how do we do that throughout the production system and provide that confidence to consumers to do that throughout? Both programs have three main components, in my opinion. The first one is training and certification for producers. The second is a site assessment and audit component for on-farm assessments. Different programs have different focuses of that, whether that's animal well-being or benchmarking type things, but both have a component of that. And then industry surveys. To go back to look at what has been done, what is the impact, what are the opportunities for improvements, and measure those things at some level. I'm going to focus primarily on the training and certification for producers component of it. If we look at the beef quality assurance programs, the way this training happens is primarily a state implemented, nationally coordinated program. So the guidelines are developed at a national level, and each state has different mechanisms, whether it's through their beef councils or through extension or different ways to do that to implement those. And then recently we've added an online option that's available through the Cattle Learning Center, through the Beef Cattle Institute, that I think is a very valuable tool in our technology-driven world we live in to help provide that option to people to do it. If we look at PQA, PQA is a nationally different program, and they've utilized in their new versions in the PQA Plus program, using really trained advisors to deliver these things, and have also added on an online renewal option for those certified producers. It's quite interesting when we talk about grassroots type thing. A lot of these trainings for these type things go on in sales barns, VFWs, and things throughout the country. Really getting down to those producers to do that and provide that introduction level to do that. Just a little bit of history on each of the programs. If we look at the Beef Quality Assurance Program, and I highlighted this first statement here, and there's kind of a timeline on the side there that you guys can read through and where it's come. But this statement that a large part of the beef industry's job involves making sure the beef is safe and wholesome for consumers, I think it speaks volumes to these programs and the industry's vision. Part of the success of these, in my opinion, is the recognition by the industry that we are in a food production industry. We are producing food, and that food starts way back when the animal is born. And things that we do throughout the life of that animal affect the wholesomeness and issues for that throughout. This is not an end user right before harvest type thing. And again, I think that is a huge volume and a mindset change for different industry segments as we do that. One of the big issues on the beef quality issues right now, or historically here in the recent history, has been market dairy cows. A big change in the progress we've made working on the quality issues with those is a recognition that the dairy industry is part of the food production industry, both from we produce milk and we produce beef. And in discussions at the ground level with producers and industry experts to make that mindset change that we are in the beef industry too, is a big step forward in my opinion, and reflects this same statement. So again, BQA began as an effort to ensure violative chemical residents were not present in market beef. And that's both from a real, that they're not there, and a perceived safety of beef. So that there's communications with the producer level as well as with the consumer levels to drive that. As it's moved forward, it's expanded to include information to help producers implement best management practices that improve both the quality grades and yield grades of beef carcasses. Again, that quality issue in there. As well as the best management practices that reflect well-being, and again remains targeted at that pre-harvest segment, again through HACCP-like principles, and the BQA program uses guidelines and best management practices as kind of their core areas to do that as they move forward. If we look at the beef quality assurance objectives, and these reflect on the pork quality assurance as well, it really set production standards for quality and safety that are appropriate to an operation can be met or exceeded. That includes biosecurity, animal health and well-being, production performance, and environmental stewardship. Establish data and retention record-keeping systems which satisfy different guidelines on the federal side. And then provide the hands-on training and education down to the ground level for our producers to help them implement these things and get those in there. And then provide technical assistance to help them do that. These are the stated guidelines of the BQA program, and you can see that while many of them have medications and treatments right in the name of the guideline, there's also care and husbandry practices, right? This is a holistic program that recognizes that the management practices affect the use of these other things and how they're reflected. If you drill down, here's the BQA stated 12 best management practice areas of how they do that. If we highlight that, I would argue the ones in the red are directly related to antibiotic usage and how they do that, whether that's feed additives and medications, the animal treatments and health maintenance programs, prevention programs and processing that gets into how we administer products, record keeping and inventory control, how do we manage what we have on site and to do that, what do we do if we have a breakdown in the system to respond to violations. Culling management has become a large one. This gets into our market cows and things like that. What do we do to appropriately manage to prevent these things? Care, husbandry, and other considerations. Again, going back to the holistic programs, and then what do we do with contamination and adulteration that happens at that level? This is just an example of one of the guidelines. So if we look at the feed additives and medication guidelines, this goes through kind of the highlights in that area. Use only FDA-approved medicated feed additives and rations. follow the FDA current good manufacturing practices. This highlights a good area to me. Where else is a producer going to go to find these? I don't know many producers that are going to go to the FDA site and would be aware of what these good manufacturing practices are in doing some of these things. This is a conduit for those things as they move forward, and this applies to many other areas as well. Follow judicious antibiotic use guidelines. What are they? The programs highlight those and outline those. Remember that extra label use of feed additives is illegal and strictly prohibited. Just because you get it at the feed store doesn't mean you can use it however you want it. And this is reflected and will probably change with some of the new guidelines 2.9 and 2.13 of how they go forward. Strict adherence to withdrawal times. Keep complete records that meet the guidelines of record needs. For example, keep kept for a minimum 2 years or however that's required by laws and regulations, and assure appropriate withdrawal times as we move forward to do those. So under each of the guidelines, they lay out these things, and then each of the good manufacturing practices, more detail down to the farm production level, how to do those things. If we look at pork quality assurance in their history in more detail, again, this was developed back in 1989, targeted at producer education and certification to reduce I always struggle with this word, violative animal health product residues in pork. Again, a similar focus to the beef program, using a HACCP-based approach. And again, looking to identify practices with the potential to result in hazards and minimize the risks through education and development of those on-farm practices. And this is just a timeline on the bottom from the PQA site, how that progressed through time to do that. In 2007, this evolved into the PQA Plus program. And from my perception, this is really an evolution of the programs to more come in line with some of the customer outreach programs through the We Care programs that the pork industry had, and align those two programs with some of the issues on the animal care. But this still maintained its food safety focus, and then went to provide more information on the animal well-being and how to do that, and focused on continuous improvement in that area. If we look at the timeline on the bottom, I think it's interesting if you look, I believe it's on your right, on the right too. One of the differences right now that we're seeing in evolution, at the harvest level, there's a significant amount of packers that require PQA Plus certification from producers selling hogs in order to sell to them. And that really reflects, I think, in a recognition of the value of this to the industry to help assure that pre-harvest safety of those, as well as some of the well-being aspects of that. And there's indications that on the beef industry that's moving that way as well. To do that, it's not quite there yet. And then in the very right-hand corner, in 2008, 22,000 producers and 25,000 youth received certification through these programs. I didn't highlight it on the first slide, but you saw there's a PQA Plus youth program, really targeted at the younger generation, 4-H and things like that, and how they do that and installing these thoughts and practices at an early age. The PQA Plus program uses good production practices as their focused areas. If you look at the training aspect of what's there, and these are the 10 that they list or target and how they're laid out. Again, if we look at the ones in red, I would propose that all of those are, again, directly looking at the use of antibiotics and how we use them. They're stated a little differently than the BQA. I'm starting with, an appropriate VCPR is important, right? How we get that to do, and that partnership between the veterinarian and the production unit. Establishment of effective animal health management plans. Again, this isn't just how do we use it, how do we have a health management plan for prevention and how those fit in there. When we use antibiotics, how do we use them responsibly? Storing and administering those, feed processing protocols, establishing withdrawal times and records that fit with that are an important part of that. And then proper swine care to improve that well-being. Again, that fits in the whole production system and how we do that, and then continuous improvement as we go through. If I pull out the good production practice number 6, which is establish effective swine identification, medication records, and withdrawal times, this is an example of a component of that, right? Where it lays out based on FDA compliance guideline, what is required to have in a medical treatment record to apply that, so that you can develop that into the herd management plans. How do we keep records for the use, and how do we do it appropriately so we manage that and use those to meet the goals with that. If we move to progress or impact, this is what I like to use to talk about this. I'm not going to get into a bunch of charts on other stuff, but if we look back to the beef quality assurance, national beef quality audit that they do every 5 years or so, if we look here, this highlights the top 10 issues in that, and they look at quality issues as well as other things related to BQA. In 1991, injection sites were high on the list. That was a quality attribute issue for meat. If we go to 1995, it moved down the list, and in 2000, it was gone off the top 10 list, and it has continued to be off that list. I think this is a really good metric. Remember, this program was targeted at preventing quality issues and residue issues and safety concerns like that. But I think this is a really good metric of practice that has changed, that we can show. The fact that we've moved injection sites and the practices that go along with injection sites, the location, how we do that, is very reflective of other adoption of things throughout the program to me, and has had a big impact through that. Other things support the progress and impact that have been made. NOMS data shows changes in producers' attitudes towards types of injections and where they locate those injections through some of those surveys. Continual progress in violative residues, both in the pork and the beef industry. A lot of those, if we look at the fed cattle end or the fed swine end, the finished swine end, are just almost to nothing, right? There's challenge areas, right? Like I mentioned, the market dairy cattle. But if we look at back there, if we look at the timeline I showed, the dairy quality, beef quality assurance program 2009, if you look at it over the last 3 years, we've seen drastic reductions in those residues from that target component and the progress that's been made. And again, that's been adoption and recognition of the dairy's part of the beef industry, in my opinion, and that's been very valuable as we move forward to how we do that. So I think that's a real good testament for that progress that has happened through that without getting into down in the weeds. I'll just finish up with this slide here. This is a slide from Dr. Aloha that came out of the 2005 or 2011 National Beef Quality Audit, where they surveyed producers that have had a BQA training on the reasons why they follow BQA. And now they could answer all of these so that they're more than 100% how they add up. I think this is a huge testament to our livestock industry. When we look at the number one reason why I do this is because it's the right thing to do. And again, I think that goes back to the adoption and the recognition that we are part of, the industry is part of a food production system. This is an industry-led initiative. The information is valuable. It's taking us the right direction of where we want to go. And this is very powerful result in my mind that shows that when you ask those producers at the level why you do that, it's not because I get more money. No, that's on there, right? But it's way below, this is the right thing to do, and I'm committed to improving my business and the industry as a whole. And as we look to this issue of stewardship, I think this fits very well, that we're doing what we can right now. And as we get more information, we have a conduit down to this grassroots level for that information to go down to our producers and to develop those things to do that. And will be a very important part of that moving forward in the future. These two places, like I said, I don't represent these two groups. The checkoff dollars from both the beef and the pork industry. These two sites are a wealth of information to go to do that, and they're available. And I encourage anybody interested to go there and look further. And with that, I'll say thank you.